Hi, everyone. Welcome to another episode of GLANZ Wellness Podcast. And today it's going to be a little bit different. This is going to be a one-on-one conversation with you and me. That's it. So we're going to be talking on this episode about DSLs. So are really patients wanting DSLs? That's what we're going to find out today. Do you know what DSLs are? Do your research and ask ChatGPT. Okay, first question. These questions I got from our patients that are sending DMs through our Instagram or sending us emails with any questions that they want me to discuss during our podcast episodes. So these ones were sent to me by you. First question, can everyone get lip filler injections? Yes, everyone, both men and women, can get filler injections. Filler injections are composed of hyaluronic acid, which stimulates collagen when injected in the lip. Hyaluronic acid does is it retains water molecules to increase hydration in the lip. So it helps with adding and plumping, but it also helps with eliminating those little lines that we get because of being dehydrated, because of the sun exposure, or just aging, where we get not only lines around the lips, but also wrinkles on the lips. So that's what hyaluronic acid does. So we inject that into the lip for multiple reasons. One of them is volume. The other one is to eliminate lines or add hydration. And the third one is to prevent aging. Why? Because hyaluronic acid is stimulating collagen, so that is reversing the aging of the lip or slowing down the aging of our lips. So anyone can get them. Mostly females get them because they like, their DSLs or they like to have plump lips. But I do have patients that are males and they do get lip filler to hydrate the lips as well. Second question. What are the potential risks and complications associated with excessive lip filler injections? Filler migration or product migration, where if the filler is not injected at the right depth, what happens is you can see some patients having an external border on the top area of the lip where they look kind of ducky. So it starts protruding outwards, so it doesn't look good. It looks like that, just so that you can get a picture. Another part of product migration is not only at the top of the lip, but you can also have product migration inside the wet area of the lip. So that means inside your mouth, where if you pass your tongue around on the wet area of your lips, you're gonna feel the product right there. Another complication, if the lip injections are injected way too superficially, is you could see the product right on top of the lip and it looks like little bubbles of clear product, and you don't want that to happen. That's why it's very important to inject the right depths and to make sure that the person and the provider that's injecting you knows what they're doing and knows how to inject lips. Another complication that can happen is excessive bruising. For us as providers, obviously we always tell people they can bruise, they can swell, but what can happen if they kind of inject in not the best manner possible, patients can get excessive bruising all around their lips and excessive swelling. Swelling can also happen if the patients are allergic to the product. So the next day or right immediately after, they're going to wake up and their lips are going to be massive. We know as providers and experts how to treat this. But even though hyaluronic acid is found in our joints and most patients tolerate it really well, allergies is also a complication of getting lip filler. Another complication, even though it's uncommon, is nodules. Sometimes what happens when you inject the product inside the lip is that because there's a lot of inflammation, the patients can create what's called a granuloma. So that develops into a nodule where if you touch your lip, you feel kind of like a little bump inside the lip. This can happen. There are ways to treat this. So if this ever happens to you, just have to go to your provider to make sure that they treat you and they resolve it, because there are ways to resolve it. Question number 3, what is a typical duration of lip filler results and how does it vary with different types of filler? This is actually a great question. There are multiple hyaluronic acid fillers that are used for the lips, and the difference between all of them is what's called the G prime. The G prime is how cohesive or how thick, if you want to kind of like talk in layman terms, how this product is going to, when it's injected, how it's going to lay on the surface of the tissue, right? So what happens is we don't use on the lips maybe hyaluronic acid fillers that we might use for the cheeks because it might be too much of a thicker product. Now, make sure that, again, if you go to a provider, they know which fillers are injected in the lips because you cannot inject all of them. Another injection that we don't recommend in the lips, for example, is biostimulators like Belafil or Sculptra. Those, you don't want those fillers to be injected in the lips. Those are for more areas of the lower face, cheeks, temples, not for lip filler. If I talk with a patient during their first consultation, my first question is going to be, what is it that you're looking for? Some patients just want to minimize the lines and wrinkles around the lips. Other patients want excessive DSLs. They want those lips to be plump and big, and they want everyone to know they got lip filler. So based on the patient's reaction and how many times they've gotten injected in the past, I can suggest a product that's going to have those results. Or another thing that I can suggest is we're going to start with one syringe. After 3 to 4 weeks, we can go into our second syringe. In my personal experience, I do not recommend that more than one syringe is injected at a time because it's way too much for the lips. There's a lot of vascularity and vessels around the mouth. So you don't want to be blocking those vessels because you're injecting way too much product. That can cause necrosis. It can cause way too much complications, extreme swelling. You don't want to do that. So always tell your provider, I just want one. Let me see how it looks in a few weeks. I'll come back if I want them bigger. But I can give you anything you want. I can give you thin lips with amazing plump and they look a little pinkish, or I can give you the big Kylie Jenner amazing lips. So it depends on our patients, and we use different products for that. So the next question, it's kind of like, what do we do if there's a complication? How can individuals safely dissolve or reduce excessive lip filler if they are unhappy with the results? We see that in the office. I've seen patients where they come in, they got injected in their house by a friend. It blows my mind every time, but yes, it happens. And they are unhappy with the results. I've seen it all around the face. It can be on the under eyes. You're going to see a video about that on our Instagram, but it can also be fillers. Whether it is they're uneven, they don't like how big they look because it's not their style, whatever reason it is, there is a product called Hyalenex or hyaluronidase, which we use to dissolve hyaluronic acid. It's an injectable product as well. So you come into the office, we numb you, and then we inject Hyalenex to be able to just dissolve the product completely. And it does come with swelling and bruising. That's just part of injecting Hyalenex. Unfortunately, it does hurt a little bit, but I think it's very tolerable. I think everyone tolerates it because if you don't like what you look like in the mirror, you don't care what you have to do, you want that dissolved. So Hyalenex is a product that all physicians should carry because it's also used in case of a vascular occlusion. So even when you're getting your lip fillers done, ask them if they have Hyalenex in the office because that is a very important product. If they tell you they don't have Hyalenex, you need to run out of that office and do not get injected. If you don't like your lips, but you do not want to definitely just go ahead and dissolve them, then you just wait. Lip fillers tend to last around 6 to 8 months, and your body's going to consume that filler and metabolize it. And your lips, they will stimulate collagen and they will come back to close to what they were before. The last and final question, how can healthcare professionals ensure that patients' desires for lip enhancement align with safe and appropriate practices? I love this question, and whoever sent it to me, you are a genius. Yes, first, you need to know your provider. You want to make sure they are a good injector and they've gotten enough training to know how to treat you with amazing results and reduce the risk of complications. Even though complications can always happen, you want to have a provider that knows what they're doing and they can help you if the need becomes something that happens during your appointment. The other thing, which I think it's actually the most important answer for this question, is have a consultation. Bring your pictures of what you like. If I come in and let's say a patient tells me, I would like Kylie Jenner's lips, but they have tiny, tiny lips, it's good to have that conversation with our patients to say, listen, that's not how you're going to leave the office today. This is a process. What you see on Instagram, it's not always a reality. And sometimes those patients, you can see they've had 2, 3 syringes in the course of a year, where if you actually look at their before, you're like, oh my God, how did they achieve this? Well, it's a process. The same way we say for acne patients or laser treatments, lips are exactly the same. Obviously, I think everybody should get lips. I just got my lips done recently, and you're going to be seeing this Instagram post soon. We make sure here at GLANZ that you are covered. We numb you. We give you a dental block. So it is very tolerable. But I will say the difference that it does to balancing your face is just absolutely unbelievable. Like, it's not only when you wear makeup or your lipstick, it's just balancing the lips and the chin. It just gives your face a total different dimension where you look completely stunning. It makes such a difference in our patients. And obviously, if you do not want lips, we also offer what's called a lip flip. So if you've never tried lip fillers and you're scared and you're like, I don't know, I don't want to try injectables for now, there is a lip flip, what's called the lip flip, which we can do with Botox or wrinkle relaxers. A lip flip is basically relaxing the upper part of one of the muscles of the lip, which is going to flip your lip upwards. It is a very, very tiny and minimal result, maybe I would say 2 millimeters. But for patients that have never had lips and they just kind of want to try it, it's a very good way to start. I think if you combine lip filler with a lip flip, your lips are going to look phenomenal, and you're definitely going to have DSLs. That's what you want. But for those who do like lip filler and they love DSLs, this is why I did this podcast episode. And you know what they say, fillers don't buy happiness, but I will just cry with my DSLs. So I'll see you next week. We're going to be covering another amazing topic, you and I. So send me your questions, because this ones, let me tell you, they were outstanding. Bye-bye. See you next week.